I'm going to be talking about Mycoplasma pneumoniae, the cause of walking pneumonia. This is going to be a scene about a game of pond hockey, and we've named it Walking on Thin Ice. So let's start drawing this scene. And here's our frozen pond, where the people will be playing pond hockey. We used a pond instead of an indoor arena because we wanted the playing area to have no walls around it. And we're using this imagery to help you remember that Mycoplasma actually has no cell wall, and without a wall, it can't appear on gram stain. Though Mycoplasma don't have a cell wall, they do have their own special plasma membrane. And they have cholesterol in their cell membrane. They're the only bacteria that have this. These sterols act to stabilize the cell membrane, but also allow them to be more flexible. So we'll help you remember this by drawing a goal here, and pretend the net represents the cell membrane. If you look at the pattern of the net, you'll see a bunch of ringed structures with 6 points, a lot like a benzene ring. This is because the molecular structure of a sterol is actually a 4-ring structure, and we've highlighted 4 so that it looks like a sterol. And just like we've represented our net as being composed of a bunch of cholesterol molecules, so is the mycoplasma cell membrane. Actually, you may remember from biochem that all eukaryotic cells have sterols in their membrane. So this is somewhat unique for a bacteria to have this feature. Now I'll move on to the clinical presentation of a Mycoplasma pneumoniae infection. Mycoplasma causes an atypical pneumonia, much like Legionella or Chlamydophila pneumoniae. And remember, these are referred to as atypical pneumonias because you can't readily culture and isolate a microbe. And specifically, Mycoplasma causes a disease often referred to as a walking pneumonia. This is because although patients have an X-ray that shows perhaps even a severe pneumonia, they may not appear all that sick clinically and even be walking about, versus a pneumonia caused by, say, strep pneumo, in which they'd definitely be in bed. So as far as clinical presentation, all you really need to remember for step 1 is that the X-ray appears much worse than the patients do clinically. And the X-ray may just be described in the question stem as having a reticulonodular or patchy infiltrate. And to help you remember this patchy infiltrate, we're going to draw a patchy collection of clouds in the sky. Notice now it seems like it's horrible weather for pond hockey, like there's going to be a terrible storm because of these patchy clouds. Well, the weather, just like the X-ray, looks much worse than it actually is. This is actually a great day for playing pond hockey. So now let's draw our players and referee, and you'll notice the referee looks like he's walking on the ice, and that's your cue for walking pneumonia. Now let's talk a little bit about the demographic most at risk for Mycoplasma infections. Question stems may go out of their way to describe this demographic and really clue you in on the bug. So Mycoplasma infections have an increased incidence in young adults, especially in areas of close contact. And one way they often clue you in on this is to talk about a military recruit, because they're both young and in close quarters. So to help you remember this, we're going to make our goalie's uniform a military camo jersey. And to remember that it occurs in young adults, well, we have young adults playing hockey, but we'll also add the number 30 with a less than sign in front of it. So altogether, it happens in young adults, especially military recruits. So these should be strong enough to help you make these associations. So now let's say a question stem does give you a young adult with pneumonia symptoms who happens to be a military recruit, and now you're pretty confident that you're dealing with a Mycoplasma infection. How do you confirm your diagnosis? Well, unfortunately, culturing takes a long time, takes about a week, and it requires a special media, so it's not really routinely done. But there is another useful test for diagnosis, and it's actually pretty highly tested. So let's go over it. About 1 or 2 weeks into a Mycoplasma infection, people may develop IgM molecules that agglutinate erythrocytes in cold temperatures, specifically around 4 degrees Celsius. That's not important. But what is important is that these are called cold agglutinins, and they're only present in about 50 to 70% of the patients, so it's not terribly sensitive. But again, I said it does tend to be tested, so we'll put in a nice memory hook for this. So to help you remember this cold agglutination, or clumping of red blood cells in cold temperatures, we're going to start by drawing some pucks shaped like red blood cells. Now we're going to draw some small IgM snowflakes bonding and clumping the pucks together. Why do we choose snowflakes to represent IgM? Well, again, if you look at the molecular structure of IgM, they're pentamers, and they're arranged in a circle, so they look a lot like snowflakes. And importantly, snowflakes occur in the cold. So we're going to have our IgM pentamer snowflakes connecting the red blood cells in the cold, which means cold agglutination. And you should also keep in the back of your mind that this process can lead to the lysis of red blood cells. So I did say you don't really culture mycoplasma all that often because it does take a long time, but that doesn't stop the boards from testing you on which media is used to isolate mycoplasma. And it's called Eaton's agar. To help you remember this, we're going to have a sign here that says, "Do not eat on ice." Eat on will stand for Eaton's. All right, now let's move on to the treatment of Mycoplasma pneumoniae. A lot of antibiotics we use commonly target the cell wall, but since Mycoplasma has no cell wall, we're obviously not going to be able to use any of those antibiotics. So instead, a good choice would be to use macrolides, such as erythromycin or zithromycin. To remember this, we're going to use our macrolide symbol, the macrolide crows, and they'll be sitting here casually checking out the game. And that's all for Mycoplasma.